Hello, everyone. Welcome back. Good afternoon. I'm Steve.
And I'm Scott.
Together, we're Backyard Musings, the Science and Technology channel.
Yeah, and we are talking about an interesting one today. I'm sure most people, unless they're living under a rock, have heard of this stuff, and it's being pushed by a lot of celebrities. But it's pretty worldwide out there. A lot of people using this stuff. So let's talk
Yes,
about it.
it's turning out to be a one-a-day drug. You know, like aspirin used to be. Taking aspirin in the morning, and you'll be fine.
Yeah.
New research reveals that tirzepatide and semaglutide both offer strong early heart protective effects. A major new investigation from Mass General Brigham has directly no relation to the Latter-day Saints. Brigham has directly compared the heart protective effects of two popular diabetes medications, tirzepatide and semaglutide. The findings reveal that both drugs significantly lower the risk of heart attack, stroke, and death from any cause. You heard that right. The
Yeah.
results were published in Nature Medicine on November 9th, 2025, and presented at the 2025 American Heart Association Scientific Sessions. Would you like to know more?
Earlier studies had already shown that semaglutide helps guard against cardiovascular events such as heart attacks and strokes. However, it remained uncertain whether tirzepatide, another widely used treatment for type 2 diabetes, offer the same protective advantages.
To explore this question, researchers analyzed national health claims data from nearly 1 million adults who are taking tirzepatide, semaglutide, or other medications prescribed for type 2 diabetes. Probably used AI.
Yeah. This is a quote. Randomized controlled trials are often considered the reference standard in the medical evidence generation process. However, not all questions can be answered using this time and resource intensive method. This is said by first author Niles Kruger, MD, a research fellow in the Division of Pharmacoepidemiology and Pharmacoeconomics in the Mass General Brigham Department of Medicine. Okay.
Pharmacoeconomics. What is that? I know
I,
epidemiology is, the skin.
I have no idea.
Quote, data generated in clinical practice and used secondarily for research allow us to address a wide range of clinically relevant questions, time, and resource effectively when applied correctly. Moreover, we can study patients who reflect the reality of everyday clinical care in contrast to the highly selected participants of randomized experience.
The analysis showed that both medications improve cardiovascular outcomes for people with type 2 diabetes who faced a higher risk of heart related complications compared with sitagliptin,
Yep.
a diabetes drug known to have neutral effects on heart health. Semaglutide reduced the combined risk of stroke and heart attack by 18%. Tirzepatide also showed benefit, cutting the risk of stroke, heart attack, and death by 13% when compared with dulaglutide, another GLP-1 receptor agonist that has been in use for several years. Okay, never heard of that stuff.
Quote, both drugs show strong cardioprotective effects. Our data also indicate that these benefits occur early, suggesting that the protective mechanisms go beyond weight loss alone, said Kruger. The exact biological mechanisms underlying these protective effects remain unknown.
Because these medications have only recently become available, studies confirming their cardioprotective mechanisms, particularly those directly comparing the two dominant GLP agents, tirzepatide and semaglutide, are still lacking.
So here's another quote. According to recently presented database analyses by the respective manufacturers, each company's own drug appears to reduce cardiovascular risk much more effectively than the competitors, said Kruger. I don't know that I trust that a manufacturer is doing this research because, of course, they're going to say this is better. They might embellish the results too. I'd rather have a neutral third party. So, continuing the quote, however, our study found only small differences between tirzepatide and semaglutide in cardiovascular protection among populations at risk of adverse events, underscoring that both agents provide protective benefit and could be integrated into clinical cardiovascular practice.
Quote, we hope that our study will help clinicians better understand how these two medications work in clinical practice. are transparent and open science practices, including pre-registration of a public protocol and shared analytic code, are designed to support scientific discussion. And that is said by the last author, Shirley Wang, PhD and an associate epidemiologist in the Division of Pharmacoepidemiology and Pharmacoeconomics in the Mass General Brigham Department of Medicine. So, got a couple of those people with the same bona fides.
Yeah. So it's interesting how the drugs have a primary thing that they can fight and a secondary thing that they can fight. It's fascinating. I mean,
Well, what is the first thing they say? The first fight against diabetes is manage your weight, right? Which is managing your diet. So manage your diet, manage your weight, and then hopefully things will work out. We have a mutual friend. If I mentioned his name, you know who he is because he's a mutual friend. And he was not your typical looking diabetic character. And he changed his diet a little bit and pretty much got off all of his type 2 meds. So,
wow.
Yeah. And
started eating fresh.
What's
cooking
that?
Fresh. He started eating and cooking fresh.
He didn't really get into all the details when he was telling me about it, but I would imagine a lot of it had to do with the diet, cooking, and the type of cooking and stuff. So, but yeah, it can be done. I mean, maybe not everybody, but it can be done. So, anyway.
All right, folks, you heard it here. Thanks for joining us.
Take care, everyone. We'll see you tomorrow.